Hello, friends. Hi. Hello, hello. So today I'm going to talk specifically in this series to any healthcare professionals that have been working in different capacities within the healthcare sector or healthcare industry, but not necessarily in the healthcare IT tech area. The reason for that is I've received questions, and I do receive questions actually pretty regularly about how people can transition into the healthcare IT or tech field area. So I'm talking to you right now. So first of all, you do know you've been solving problems in healthcare. Now it's time to implement these solutions that actually work. You could help to implement those solutions. In fact, since you're already in healthcare, or even you might be completely in a different industry other than healthcare, but your background could be more valuable than you think. You have the transferable skills that can be transferred within healthcare, and you could use those skills to help in any solutions that are being built. Hi, my name is Rachel, and in this quick session, I'm going to show you how non-clinical professionals, specifically also those that have been working in healthcare, but also those who've been working outside of healthcare, can pivot into the healthcare IT or tech area or field. And you don't have to necessarily be a coder. You don't have to necessarily have the very deep tech knowledge or skill sets. But in the capacity that you're in, you could actually work in this area. So first things first, I would like to ask you, please, if you can subscribe to this channel to be notified. And also it helps me greatly that if you subscribe, that one, it tells the rest of the people, the algorithm, that we are live. There's a video that's live and that people are interested in actually watching it so that it can let others also watch for those that are interested in this type of information to help them. Okay. So please remember to subscribe, and I hope and also like the video if it's added value to you. Okay, so let's get into it. So first of all, okay, what is healthcare really? Healthcare IT, that is really, what is it about? When we talk about healthcare IT, we're not just talking about, the software developers or the electronic health record engineers or even product engineers or, the scientists who are researchers or anyone essentially who works in the deeper knowledge of, IT. Excuse me. So what we're really talking about is people who may be working in any area that engages with patients or patient tools, people who are working some kind of automation of workflows, not necessarily in the tech area. You may also be in some kind of helping to provide digital experiences for patients or providers like telehealth. You also could be working on the back end, processes. Back end meaning, if you're working where patients are going to be, onboarded, meaning access. If you're working where there are coders, if you're working in documentation, if you're working in billing areas and all the different areas of that, back end processes. You could be working in communications, you could be working in marketing, in all those other roles, essentially roles that help a healthcare organization or healthcare IT organization in this case to run smoothly. Okay. These areas are areas where they're needing the people like you, people who have your skill sets. Okay. So talking about that, let's walk through what some of the examples are, how your backgrounds could translate well into the healthcare industry, meaning healthcare IT or tech industry. So one, we may have people like, scientists or researchers. The areas that they could be have worked perhaps would be where they're collecting data, they're doing clinical trials, and maybe they're bringing the analytical, skill sets or documentation precision and that comfort of compliance or reporting, where they have been doing reporting and analytics of what they're finding in the data that they're doing research on. Okay. So that translates well into, for example, data quality analytics, regulatory reporting systems. Okay. Then we have also people like digital or web designers. As you know, if you've been a patient, you've been on the receiving end of services, you probably, for the most part, at least had a chance maybe to be enrolled to have what they call a patient portal. Or maybe, especially like during COVID, we had to meet with our providers via either the phone or video, which was Zoom, telehealth, or if it wasn't Zoom, it was some other form of telehealth. Telehealth meaning that it was via some other communication tool, okay? So you find that for things like that, you as a designer could help to design those actually on the web. You could be a front-end designer for the healthcare technology, and they will refer to you as you're working for example, like with engineers, they could refer to you like, hey, is this okay? What do you think about this design and that kind of thing? You could be helping with wireframing, prototyping, those kinds of tools to help really to ensure that they're working right. Currently, there are many actually platforms that are specifically for this, especially that they're serving populations in rural areas. And so you find that they're literally separate companies that are creating these kinds of platforms. So you find that your skill sets could be needed there. Okay. Third, you may find, like, for example, if you've been a trainer, if you've been a teacher, if you've been in learning or some kind of development like that, you could actually, those skill sets are very needed. You could help within creating curriculum, instructional design, and also perhaps support as you're leading or teaching or coaching during go lives, what they call go lives. So if, for example, there is a system that's being implemented or a tool or even an EHR itself, you find that usually there will be a need for training, training of end users or training of any users of the system. So they'll need those skill sets. Okay, so that's very important. And fourth, you also find that if you have been like a care manager, currently there are care managers. Sometimes um, they work on the hospital side. Sometimes they could work actually on the insurance side. Okay. But anyway, you are maybe a patient advocate or patient navigator. You find that those also can be actually translated and you can work for a healthcare tech company. So I gave an example earlier. You find that right now there are companies, healthcare tech companies that are doing innovation in those areas, either with AI or even non-AI, but they're creating those platforms that are going to help people in different capacities. Okay. And you find that they may need your help to help with maybe workflows, to help with patient engagement, or even some kind of implementation, or even design. Okay. So those skills could be translated on the healthcare tech side or healthcare IT side. The other ones are marketing and communications. By the way, this is not an all-inclusive list. I'm just giving an example. So those are almost 5. Okay. But there's so many others. And I'll be showing you at the end of the video, as I've been doing in the other prior videos, just to give you a walkthrough of what some of those roles are and what those could look like. But anyway, continuing on, you find that there's marketing, there's communication. Those are all needed. within the healthcare communication side, healthcare IT side. And they could need, for example, your product marketing or even marketing, yes, for the company itself, either on social media platforms or even go to market, GTM that is, or any other capacity. And then also communication with internally or even patient communication workflows. Like, for example, email, like SMS or text messages, and also onboarding. They may need your skill sets in that capacity. So you find that all these skill sets are really all needed. Okay. So with that, with these examples, how then does this all come together? Okay. You find that you, as someone who has prior experience, you're not going to be starting from scratch. I've said it and I'll say it again. You are starting from where you are. You're adding to what you have. You're going to be, upskilling. Now, there will be some other skill sets that you may have to actually learn. And that is what I call upskilling or reskilling yourself. In other words, you may be adding on to what you already have. Okay. But you're not going to be starting from scratch. And that's where your experience comes in. Okay. So with that said, you find that you are integrating your knowledge with the industry knowledge wherever you're going to be coming to, whichever space you'll be coming to. You're going to be helping improve patient access, meaning patient onboarding. You help also for the clinical staff and the way they work. Okay. Like these days, they're trying to reduce all the a lot of the documentation that providers have to work on because it's actually creating burnout. Some of them have to stay behind just to do paperwork to ensure that they finish because as they're working with their patients, then they have to come back later and actually complete that. So they're creating, for example, tools that can help to transcribe as they're talking to patients, and then other tools that can help even further get insights into those communications with the patients, between the patients. Then also you find that how it ties together, systems efficiency, also your skill sets helping to resolve any gaps that may have been there. Because if you know what maybe were the ongoing problems or ongoing issues or shortfalls or things like that, you could help, especially with AI that's being used right now to resolve many of these problems. You could be helping actually to resolve those issues or those problems. So really, really, your skill sets are very needed. And also any other processes on the back end, and other departments like sales, like marketing, and also recruiting or people, as they're called, in different capacities. Okay. So with all of that said, then, if you're someone who's ever thought that healthcare sounds interesting, but I'm not a coder or I'm not this type of tech person, I don't know tech or anything like that. Listen, you may not necessarily be doing anything tech related, but you could actually work in a healthcare, IT, or tech company. So don't think that your skill sets are not, if you're someone who's been interested to, to transition or to pivot into the healthcare tech world. And you're not behind. All you have to do is to reposition. And this is the area where I can help you with that. Okay. So if you need more information, you'll be finding it down in the description. And I'll be providing more of how I can provide you, how you can contact me to help you with that pivot. And also, one thing I want to say as we're closing out is that I want you to also, remember that it's not just the people who, have been working in healthcare that actually can also convert into healthcare IT. If you have a skill set even though you've been outside of healthcare, okay, you can actually come and work into it in this area. The other thing is that with everything going on, I think sometimes, especially if you've been laid off, maybe it's good to take some time and a bit, step back a bit and think about strategically, where is everything going? Okay. Where are the areas where maybe they will not, at least, I'm not saying they would never let people go in the healthcare industry. Maybe they will. But the good thing about it is that it tends to be a bit more stable than other industries. Okay. So if you're thinking that, okay, I know, especially people, I think recently we all know Microsoft has let go of 9,000 people. That's not the first time. I think it was like the second time, that the last time it was 20,000, something like that. So look and see, as much as they're letting all these big numbers of people go, okay, and also they rehire people. Who are they rehiring for the most part? Okay, who are they rehiring? You have to think about that. Who are they rehiring? So what I do know is that, truth be told, I haven't talked about this. Um, we all know they're mostly getting H-1B visa employees. Um, sorry, people as employees. And also, they're probably many times, not all the times, but many times, they're also hiring people who are starting out. Okay. So what does that mean? It means that, they want to pay less, okay, for the talent. Now, it's up to you. You can choose what you want, but all I'm trying to say is that be strategic when you are thinking of the future. Don't just rush into things sometimes. However, of course, if you want to go back, because, I have had that some of the people are going right back and to be rehired, and maybe that is happening, and that's good. But I've also had people who have gone back and they let them go in just a short time again when they were rehired back in the companies they went to, the big tech companies, okay, or the tech companies. So all I'm trying to say is that maybe try something new, different. After all, you're going to really reuse your skill sets because they're needed. You may need to learn something. By the way, even the people they're hiring, they're hiring, sorry, in the tech companies that have let people go, they're also going to train these people. Okay. So either way, my point is that either way, you may need to retrain. Okay. So maybe look at retraining or upskilling. Upskilling meaning you add to your skills already, or add to the skills you have, and try a different area, try a different industry sector, in this case, healthcare, IT, healthcare, tech, because your skill sets are needed. And many are well-funded, so they're paying pretty well, okay? I had today actually that Google released their, oops, sorry. I'm sorry. I had today that Google really, somehow they found the payments for Google. They paid pretty well. So where I'm going with this is that some of the salaries may not be as high as those, especially if you've worked there for a long time, but many are also pretty good. You can have a good living wage of the salaries. Okay, we're talking about. So all I'm saying is be open-minded and look into healthcare if you're someone who needs this. All right. So next thing up is I want to show you some of the example roles that that are non-tech, and they're looking for talent. So let me pull this up. Give me a minute and we can look at those together. All right. So we have this. Okay. All right. So I'm gonna bring some examples up. And then we can go from there. I think you can see my example. So here's a company, it's called Ophelia. They help actually with opioid addiction and recovery. And so you have remember I gave also an example of case managers or care managers. You have someone like that in this case who has been helping with someone who has been helping with recovery, and that they are going to, they're going to have people, they're going to help people who are recovering, with some of these, with the problems that they're having. Okay. So you have this role here, care manager. And the thing I want to pull you into, um, is just to show what type of experience they're needing. Okay. So you find that what we are looking for in someone, I'm going to look here. Okay. This is here they tell you, first of all, what you will do in this role, what are some of the things you will do. Um, and here they look for what they need in someone, the skill sets. So these days they're saying it different. Before they say the skill sets you must have. But here they mention what it is that they're looking for in someone. Okay. So you find that, first of all, I just want to see here. Practice active listening, empathy. So you're someone probably who has worked already in some kind of customer support or manager or things like that. Okay. And you have worked experience working with outstanding patient experience. You worked with oh, there you go, customer support here. I already said it. So you've worked with patients, you've worked with patient experience, maybe you've been at a front desk, an MA or someone like that. MA is medical assistant, by the way, customer support, or ideally in a consumer focused healthcare company, meaning that a company, a healthcare company that actually services consumers in different capacities. The main thing is that you actually have worked with some kind of either a customer, a client, or anyone that you've, helped. And so you know how to do customer service. Okay. You can also de-escalate. Customer service is very important here with emotional conversations. Communication is very key, and empathy, okay? A collaborative mindset. So this is very key, okay? Um, and here they say experience solving problems that you do not have to have clear solutions to, okay? Meaning that you can solve problems impromptu. At least you come up with solutions. You're good at that. And usually that all points to customer service, okay? So customer service, but in different capacities. It could be you're giving it to patients. It could be you're giving it to clients. Clients in this case sometimes like a therapist even, they call them client, they tend to call them clients, or consumer, like even could be retail focused here. Sorry, yes, consumer or customer. I'll call this customer or consumer. Could be something like that. Let's say even like at a CVS, okay? Maybe you've been a tech pharma tech or something like that. I'm pulling this really out, even me off the top of my head, but I'm just giving examples that that is the type of service they need. Okay. So moving on, another company here. Let me go here because let me move my, okay. Move that down here. It's obstructing. Can't see, but it's obstructing me. Okay. The other one is another company, Solace. Solace actually also works with, I think it's mental health. Yes, mental health. And, but they provide like supervisory services to people who when I say mental health, actually, it could be counseling. It's not necessarily like, someone is in a mental health hospital, but it could be counseling, but they need people who can help with a supervision. Okay. So they give here what you do, bring beauty and simplicity to complex ideas. So let me first actually go to what the position is. This position is a marketing designer. Okay. Again, it's marketing. Remember, I said it that you may have worked in healthcare or before, or it doesn't necessarily have to be healthcare. I'm specifically talking to people who have worked in healthcare in this case, but are in non-clinical roles. However, they're not the only ones I'm talking to. You could be that you've worked outside of healthcare, but still your talent or skill sets are needed. So here you can see it's design, but in marketing. So they talk about bringing beauty, simplicity to complex ideas. In other words, you're going to be helping with design here. Product high quality. Again, this is all about product. Produce high quality production ready designs. Okay. So best in class experience. You can be autonomous. You bring full ownership to your work. So what do you bring to the table? Let's see who you are. Okay, no, that's who they are. What do you bring to the table? They say you're comfortable with ambiguity, meaning that you're creative, you come up with solutions, even though there were no solutions. Again, they're talking about beautiful, for curiosity for all things beautiful. This is all about design, as we saw. It talks about while we do not design for design's sake, your appreciation for finer detail matters. Good design isn't noticed but felt. So again, design, okay? If you've worked in design, you've worked in marketing, they need you. Great communication skill sets that help work with the product and engineering team, okay? To make the visions that are being created to come to fruition, all right? So they need 2+ years of relevant experience. For consumer web products or for desktop and mobile. I like this because if you're 2 years, that usually they'll say that is someone who's I won't say it's entry, but it's considered entry in industries. And then anything like around 5 years is where now they say at least you have the experience, mid-level there. And then 10+ usually is when they say that, someone who's an expert and things like that. But 2 years is considered entry. So if you have this level, you are really open to getting into into the healthcare IT industry to help with that. Now, this particular company, I looked it up earlier, they're based in Maryland. So I think they don't have the law that at least give a salary, because I also like to show the salary range, but I think it must be a good range. Why? Because I wanted to show you that this is a remote. By the way, it's a remote position, so that is very good, except you have to be based in the United States. Okay, that's the only thing. And let me go here. I think that's where I want what I need. Where as a marketing about the role. Okay. So anyway, Solace, the reason what I was looking for is that, it might be here. Let's see. Yes, here it is. We are Series B startup founded in 2022, backed by Inspired Capital. I mean, you see all these VC companies that have given them, have funded the company. So what I mean is that usually if you see that, at least they are going to be paying well. Okay. They have a bit of they have quite a bit of funding, so they'll pay well. But I don't know the range. However, I wanted to show you what the range would be. Sorry, I wanted to show you that companies like this, at least, they will be having the funds to actually employ the people. Okay. Next up, same company, but in this case, it's for a healthcare advocate. Remote 1099. Now, if you're someone who has not worked on our self-employment basis, this is what 1099 means. It means that they're going to see you as a company. So the thing about it is that you can work with them as a sole proprietor, meaning you don't have to create a company necessarily, like an LLC, C Corp or S Corp or things like that. But that's a whole different thing. You have to talk to your CPA, your accountant who can help you with that. But you can also work as a sole proprietor, whereby they use your social security number. As long as you have one, you can do that. So here they'll pay you as a company what they call 1099, okay? And you have to pay your own taxes. So hopefully you've done that. If you haven't before, they give you options. You can work as full-time or part-time, actually. Okay. And here is the part-time and that's the full-time. So this is the range per month that you will receive. That looks good, actually. But they also pay a bit more when it's under 1099. I know because I've been a consultant, by the way, and have worked in this capacity. They tend to pay a bit more when you're 1099 because you have to pay your taxes. So that is very, very key. If this is a position one would be interested in, you would have to talk with your accountant or whoever files your taxes to help you with that. But that's what that means. All right. Anyway, so here it's they say 3+ years proven experience in care management, patient advocacy, or you've worked in healthcare navigation. Healthcare navigation usually is when there's a telehealth component of it and you're helping patients, navigate the whole gamut of their care. Okay. A lot of that entails also seeing with their insurance. Many tend to be on Medicare, Medicaid. So you're helping them navigate those areas and also really helping them when they give them a care plan. And this also tends to be patients. They're not the only ones, but sometimes they could be patients with chronic illnesses. So it could be seniors or just other patients in that population level that have chronic illnesses. So the diabetes, maybe not heart failure, but high blood pressure. That is bad, by the way, because people after a certain age tend to have it. And then anything else that could fall under that realm, okay? But the main thing I wanted to show you was that you have a deep understanding of social determinants of health and experience working with diverse patient populations. So this is very key. That's why I was also using the word population, because that's where a lot of this falls under, okay? So pride in your technique, this is the point I'm talking about. Pride in your technical savvy, and you can quickly and fluently learn new systems and software. Okay. So this means that you work with probably other softwares in healthcare, any type of EHR or any type of platform and things like that. Okay. The softwares don't tend to be very difficult in this case to navigate. But that's what I wanted to show you. Okay. So last, this is another company. It's called Abridge. This one is helping really to create solutions for providers to minimize the amount of paperwork and documentation they have to do. So meaning that this is one of those solutions whereby it's helping to to convert the conversations that a doctor, a nurse, any type of provider, clinician, let's say, I'll call it a clinician, a therapist, is having with their patients, and they'll transcribe it, and convert it into notes that they can actually enter into the patient's chat automatically without them stopping and having to type and do all of these things. Okay. So that's what this company, Abridge, is doing. It's actually been very successful. And implementing a lot of its solution in many hospitals. I wanted to see if I can show you. Let me see. Platform. So you see clinicians, rev cycle, and others. Resources, customers. Let me just show you customers. It's one of those that has had many here. So many that has had many example customers. So these are they're some of their customers that they've had here. Okay. And they're still growing. As you can see also here, this is some of the lineup of where they've implemented their solutions. Okay. So going back here, let me just have a sip of water. This is San Francisco base remote, but San Francisco. Anyway, this position is operations manager, technical support. I wanted to give you this example. They have, by the way, many, but I wanted to give you this example. Why? Because it combines a couple of things. If you see here, it says serve escalation point for tier 3. So if you worked at a help desk or in support before, you know that there usually are tiers to the support. Tier 3 tends to be where it's a more complex problem and they've escalated it to that so that that level of support can really help the customers, okay? Can help the customers. Okay. With that said, here's what they ask that you can bring. Excellent verbal communication skills, that's number one, usually with customer service. Okay. Being detail oriented, as you see that. Okay. But what I wanted to also show you here, required engineering skills. They also require the tech side of things here. So even though I put this, I put this as an example, I just wanted to show you that you may not necessarily have done a lot of deep programming, or maybe you did that, but you're no longer doing it as a software engineer or as a programmer, but you have knowledge of that. However, these are the things they want you to know, integrations, which is the APIs, and you have the ability to debug user-facing issues. Tools like Jira, this is tracking tools, really issues where you report or track issues. Jira is one of them. Jira also can do actually as a project management tool. Familiarity with tools like Postman, browser dev tools, things like that. Typeset. These are really developer tools here. Okay. GCP is the Google Cloud product here. As they say, you see here basics coding skills. So you may be like maybe you're no longer coding, you've coded, or even that you haven't coded deeply, but you have done some coding. Maybe you did some training in that and you've done coding. So it doesn't have to be deep. Then bonus points here, they say experience integrating in experience with integrations into or working with electronic health records, okay, at large complex organizations. So here, if you've done any type of integrations, that is really good with different EHR systems. EHR systems are electronic health record systems, okay? Epic is given here because it has the biggest market share, meaning you find it in more hospital systems than anything else. And the examples I showed you of their of their customers up above, those tend to be big healthcare systems. When I say systems, it's different from a healthcare company. A company can be, it's kind of the same, but a company can be a bit smaller than the system. The healthcare systems tend to be several hospitals that are all under one big company. Okay, so that's what that means. The complex organizations. And also familiarity with systems requiring strict adherence to privacy and security protocols. So if you've done the SOCs, so the SOC, cybersecurity or things like that. You may not have done cybersecurity necessarily, but at least the security protocols, which has SOC, those are very needed. And then knowledge of tiered support. This is what I was talking about. You worked at a help desk, you worked at support, at least you know about escalation and the protocols, because you may have, as a manager here, technical manager, you may have to create those as SOPs or standard operating procedures and things that give people guidance to follow when they're escalating different issues. So it says 2 to 3 years of experience in technical support, 2 to 3 years of experience in collaborating closely with the development team, and familiarity with GitHub and PRS process. So these are also development tools, platforms, excuse me. Okay. So I like that it's 2 to 3 years. It's not too many years. So if at least you're someone in that area, you're beginning to get into the mid-level experience level, this is for you. This is for you. So look into it. Okay, something like this. But one thing I want to say is that they say they want someone, this one, I think it's required. Let's see. Did they say it as nice to have? Okay, bonus points. It's the same as nice to have. So if you have some experience with the EHR system, that would be ideal. But one of the things that I do help professionals that are converting into the healthcare tech or healthcare IT is I do have training and coaching on the workflows within healthcare, so that when you start going in and working within the healthcare, when you bring your other transferable skill sets in the tech area, okay, that this is easier for you to understand, because it can get frustrating. When you don't understand how the workflows are. Okay, so that is one of the things. So I'm going to stop here because there'll be too many, but the other thing I wanted to show you is a program manager, clinician onboarding. This one specifically, they say program manager. It was more actually over training and curriculum, which I gave some examples earlier. Okay, so you're going to be strategy and program leadership. If you've done, for example, project management or program management before, okay, project management is really the underlying belly of this, the program leadership or management. You know how to manage the projects that are going on, what to do, what is going on. This is also an area that I do train in actually, or coach people in. But anyway, in any case, if you've done that, also helping, if you haven't done that, this is something you can learn. Okay, but the main thing is the curriculum development and content management. So you have to have known at least how to design and maintain comprehensive curriculum for training clinicians across all platforms. So that's what you'll do. The technology and tooling, implementing any LMS, these are learning management systems. They could be different ones, okay? So I'm going to skip over to what you bring. 4+ years of clinician training. Essentially, you've trained clinicians on the side, enablement or onboarding, ideally in a health tech industry, in a health care delivery area or clinical education setting. Okay, so essentially you've done training, but the training has to have been at least in some capacity within healthcare or training clinicians. Okay, it doesn't have to be clinicians, but healthcare is also good, is ideal, because when you're training end users, it's all within the healthcare realm. Clinicians is that, I think, understanding what the workflows are. That's what that comes to. Also having experience with implementing or managing a learning management system. Okay. So there are many you may have. By the way, this is not used in healthcare, but I'm giving you an example. You maybe have had Kajabi, there are many out there. You've had Kajabi, you've had Teachable, Thinkific, you've had let's see what, ZenLab, you've had a few others. Okay, but examples as learning management system, those are the ones that you've worked with. And you have some familiarity. That's bonus points. Nice to have with the Epic system if you've worked with it. You don't have to, but it's bonus points if you have it. Okay. Or also the other thing here would be workflows within healthcare. That's the other part. Okay. They say you have a passion for improving healthcare through better technology adoption and clinician experience. I think this one, probably someone, because it keeps mentioning the clinician experience. This would be probably with someone who has done the training before within the healthcare systems. It would be best that it's someone who has done that. Okay. Again, my my video here is about people who have worked in healthcare before. Okay, so those are some examples. I'll stop here. I don't want this video to be too long. I hope you get some idea. Again, there'll be more information below. So feel free to, feel free to, to to contact me or click on any of the information below and you get more information. Okay, so thank you very much. Again, remember, please to like this video if it's added value for you and also to subscribe to the channel. Thank you.